Welcome back. As you heard earlier in the show from Debbie Wasserman Schultz, the state's nursing homes have suffered widespread outbreaks of the coronavirus. Dale Ewert is the executive vice president of the union representing thousands of nursing home workers, SEIU 1199. He said while some homes are better than others, many nursing homes are not keeping their staffs up to date.
A big disappointment has just been an overall lack of communication and transparency. When the state issued its list finally, there were 5 of our facilities where we had good reason to believe there were COVID positive patients, and they weren't on the state's list. And there were another 9 facilities that were on the state's list where we had no information. And that certainly indicates to us that management at those facilities were not being transparent with their staff about what was going on in the facilities. You can't protect yourself if you don't know what you're dealing with. And so, PPE and many other issues we'll talk about are important, but it has to start with understanding what you're dealing with so that you can then make decisions about how to protect yourself and understand what you need to know and what you need to have. If you don't have that information, you're at a disadvantage from the start.
Are you satisfied with the level of testing that's being done within nursing homes and ALFs, particularly for staff?
Well, we've seen very little of it, frankly. In most cases, again, not at all. I don't want to paint with the entire industry with a brush, but in most cases where employees have presented with the symptoms of COVID, the coughing, the fever, shortness of breath, rather than being tested, they've been quarantined without being tested and then returned to work when they were no longer symptomatic. Some employees have gone out on their own and sometimes at their own expense to get tested. And what I understand is that the state has now said that the Florida National Guard is going to be going from facility to facility to conduct widespread testing, which is a welcome development. But I can tell you, I checked with our team this morning, and we have not yet seen the Florida National Guard at any of our facilities doing testing. I'm not saying they're not doing it, but we haven't seen them in our facilities. And so I don't really know what's going on. If that's happening, I hope they ramp it up quickly because this is an important part of what we need to keep our caregivers safe, but also to, let the rest of us eventually out of this quarantine situation we're in, the shutdown situation we're in, and do it safely. You can't do it without having a more robust test procedure than we've got.
Talk to me a little bit about that phenomenon of what the caregivers in nursing homes are dealing with that the public may not be aware about.
That's a good point. I mean, first of all, let's talk about who these folks are and the jobs they do. Nursing home workers are overwhelmingly female, people of color, large percentage of immigrants or people from immigration backgrounds. The work is low paid, even under the best of circumstances. These are poverty level or close to poverty level jobs. The average wage for a certified nurse assistant in Florida is somewhere around $11 an hour. And often these workers whose jobs are to provide health care to seniors have neither health care for themselves that they can afford or retirement benefits. And these jobs, in addition, are also very physically demanding. These are jobs that provide personal care and assistance to people who can't always take care of the activities of daily living, simple things like getting out of bed, going to the bathroom, bathing, eating their food without assistance. And so these are physically demanding jobs. So these are difficult to begin with. And then, as you say, one of the rewards of it, despite all of the challenges, is that caregivers are often the only family, the only social interaction that most of these residents have. And that's valuable to the residents, but it's also valuable and an incredibly important part of the work that our members do in these nursing homes. And so it's challenging to see people that you come to know, you come to love, you deal with on a daily basis die. That's difficult in a normal situation because it's part of what happens in nursing homes, but it is particularly stressful in a time of pandemic, when in addition to suffering the loss of the residents that you care for, you also have to be worried about your own health and worried about what you're taking home to your family.
This has, I think, fundamentally changed the way we should be thinking about our society and how we proceed moving forward from here. Give me your sense of what this COVID-19 virus has unleashed, both in terms of its physical toll, but in terms of really making people should be making people better aware of where we are as a society.
And I think we're dealing not with one crisis, but with three. And the first one has existed before there was COVID and has been with us now for several decades. And, you know, it's the social, the economic, and the racial injustice in our society. The fact that we have, despite Obamacare, that we still have millions of people without any health insurance at all, or with very limited insurance, that we have an economy that is based on low-wage labor, that workers' rights are suppressed. Those things were here before COVID, but the pandemic has just made those conditions worse and exposed them in a way that, as you say, I hope we don't continue to ignore them, because we need to deal with those issues. We can't blame anyone for a virus. That's nature. But the third crisis that we're dealing with, besides the injustice in our society and the virus, is a total breakdown of competence and responsibility at the governmental level, especially at the federal level. The lack of response, even to this day, the lack of acknowledgement that we have a PPE crisis, that the federal government has in its hands the power to solve this problem and chooses not to, when the result is that healthcare workers are getting sick and dying, and that it is helping spread the transmission of this disease. It's unfathomable to me why we're still in this situation. And each of these crises has made the other much, much more severe than it should have been or could have been. And we have to deal with all three if we're going to get out of this.
We'll be right back.